Hello and welcome to the Progress Connect webinar series, Rethinking Business in a COVID World. Today we have our third roster of guests. For those of you who have not tuned into one of our webinars, I am Sam Thompson, Senior Managing Director at Progress Partners, and I have the distinct privilege of welcoming all of you to each week's panel. Given recent events, the world has been filled with uncertainty. Each of our webinars so far and our panelists this week have some great perspective on how they have navigated this uncertainty and done their best to bring more certainty to their respective business.
Hello, everyone, and welcome to this strange way of delivering panels and doing it via a webinar, and I think it's working. We love this. So. My name is Pratik Dwivedi. I am executive in residence and ex-hospital CIO and a health tech innovator, and pleased to be able to lead this panel. We'll start with defining where we are with healthcare and health tech. We'll go from there. Now, I know you can read, so I'm not going to read all of this to you, but one of the things that we want to do is first make sure we are defining what health tech is and how we've contained it. And it's about technology enabled healthcare products and services. Usually this is everything other than electronic medical records, electronic health records, and electronic patient records. So the things that aren't in the hospitals in practice, we don't usually count that as health tech, and everything else is fair game. Now this space has a large variety of different offerings, whether it's business to business or business to patient or consumer. And the whole idea around this is trying to be able to build technologies where we actually provide healthier outcomes. And so it's interesting, everybody has their own perspective on what they want to do to create a healthier outcome. And what's interesting about healthcare is, and health tech is when you enter it, you have a lot of well-intentioned people trying to make a difference. Now, what's really been happening with COVID-19 and the pandemic hitting is that things have really changed. We're seeing a lot of public health officials who are tracking outcomes, and they're trying to make policy decisions. And so a lot of things we read about in the news papers, if we still read newspapers or you're watching TV and on the news, is about stats. It's about trying to glean insights from information that's being thrown at us. And what we want to do is talk about the impacts of COVID-19 on the health tech industry. When we talk about health tech, we're talking about preventative care and personal care, and not necessarily about diagnostic and therapeutic technology. Coming into the VC deal activity, what's pretty exciting here, I actually entered healthcare in 2009. It's been a 13-fold increase in the capital invested. That's not because of me, I understand that, but I'm excited to be part of this massive boom in investment. This is coming from not just small organizations, but we're seeing now health tech unicorns come out. That includes people like Outcome Health, Tempest Labs, and Flatiron Health. These are organizations that are in health tech that aren't $50 million companies, but they have valuations of $2 to $4 billion, $5 billion, and we're seeing some really large organizations form out of this. And that's what kind of makes it exciting, because it's a maturing industry. So, and we also see that, you know what, this looks big, but I think you probably spend more time looking at gaming and then one of these health than any of these industries. So this is a very different way of looking at life. This is here to help, but it's still at its infancy in terms of growth, and we're looking forward to continuing to grow. In terms of healthcare and the pandemic response, you hear one of the new things that we're hearing a lot about is Apple and Google coming out with their new APIs. It's quite interesting because contact tracing has already been proven to be effective in places like Taiwan and South Korea. And what we're trying to find out is how can we actually do this so that it's built into everybody's phones, everybody's devices, wherever they're going. And I think it's quite a big, it's a big deal to see people coming together to do this and two competitors actually joining forces to get this done. This doesn't mean we're there yet, and the public health officials still have to write their applications to leverage this, but this is a pretty impressive step in the right direction. Now, in terms of healthcare IT solutions, what we're finding is that you'll have vendors jumping in to look at screening questionnaires and looking at how to work with the infectious disease doctors, Your organizations like Blue Dot that are looking like population health in terms of cell phone data and airline data, trying to track how this virus has been moving around. And they were seeing, I was talking to the CEO of Blue Dot, and he said he's seeing a trend a flare-up starting in December. This is before anybody was talking about it, but they started seeing some odd activity and knew it was something to pay attention to. But they didn't know this was going to be something different than what's happening in a regular flu season. And that's what we've got to really start learning, and we're hoping HealthTech can really play a part in this. But we add wearables, and we all wear, or many of us wear a lot of our watches and whatnot, but they're not taking temperatures. They're not taking, they're not actually have all the sensors in it, but we're actually seeing in other devices and other geographies how technology is actually helping with remote monitoring as well. One of the great examples is on telemedicine. Like telemedicine's been around for 25, 30 years. This isn't a new concept. It's been around in different forms, but it has been around. The challenge with telemedicine, it wasn't always accepted by the consumer or the patient or the provider. And people have been talking about this and how it will be more like the George Jetson lifestyle of being able to practice healthcare from afar. And what we're seeing now is that we're stuck. And when we're stuck, we're going to do something different. And here's a great example where telemedicine is being more accepted. It's actually being getting in use, and everybody and the reimbursements of this are just quickly being settled. So there's no confusion around it. And perhaps the pandemic is a bad way of saying here's a silver lining, but hopefully this is another way of increasing post-pandemic use of telemedicine to make sure everybody's getting the care they need. What's next for HealthTech? We're going to see that there's going to be multiple waves of this. We've seen this in the flu pandemic. I was at Mount Sinai Hospital at H1N1, where the spring was easy, and then the summer, nothing, and the fall, it hit us hard. I hope this isn't the easy phase, but we know that this first wave is kind of cresting slowly. And what's going to happen as this pandemic subsides before it resurges, and what happens before the next one. And we know that we're going to be paying attention to monitoring. We're going to be paying attention to privacy, to remote care, to what the investments are going to look like. But really importantly, what else has happened is going to happen as we look at long-term impacts. Well, what I'd like to do now is that I'll introduce the panelists. We have Ana Cervantes, who's basically hands-on. Lucky to have her. She's hands-on at the Boston Medical Center in neurocritical care. We have Jennifer Radin, who's the healthcare provider principal at Deloitte and running a fairly large practice there. And Paris Wallace, who's the CEO of Ovia Health. I'm going to pass it on to each of them to introduce themselves, but also give a perspective on at least a nugget of information that they have on how COVID-19 is really changing the way they think, the way they act, and the way your business operates. Anna, why don't we start with you?
Sure. Thanks, Pratik. So my name is Ana Cervantes. I'm the clinical vice chair for the Department of Neurology, and I'm also the director for neurocritical care at Boston Medical Center and also our neuroinfectious disease service. So I think you definitely have hit on a lot of the points that we're talking about within the hospital. There are some silver linings, as you mentioned. There will be some good things that we've learned. And I think the biggest is that the way that healthcare is delivered will forever be changed. And I think a lot of what you have mentioned is about how it will be changed on the outpatient setting, which I agree is happening, but also what we do on inpatient settings and how we might be able to deliver care outside of maybe the academic kind of model for tertiary care. I think that's going to be a big way things change in the future.
That's great. Thank you. Appreciate it. Looking forward to hearing more from you. Jennifer, how about yourself?
Hi, Pratik. Thank you. And Anna, thank you for everything that you're doing. I think we all owe our frontline clinical workers just all the gratitude in the world for the bravery and heroism. So much appreciation. So Pratik, thank you for the introduction. I really loved what you were talking about in terms of the power of the consumer and the embracing of digital and digital health. About 2 years ago, I would say at Deloitte, we started a bit of a crowdsourcing strategy project where we said to people, what do you think health is going to look like in 20 years? And through this and through many, many iterations, we developed a point of view that basically articulated, we believe that at the center of health is the consumer, the empowered consumer, with interoperable sets of data and information providing insights. And that this will then drive a transformation from what is very much a healthcare economy and ecosystem to a health economy and ecosystem. And of course, digital health and health tech is such a critical, important part of that, the foundation, in fact, of it all. And it's fascinating to see, of course, with the pandemic, with the crisis, that the future of health is now right at our doorstep, and the future of work is right at our doorstep. And so this notion of what are the natural experiments that are happening right now all around us, those that are working well, both in the clinical arena and the consumer arena and the workforce arena overall, how do we really observe those and then take those forward? Because, and Anna and I were talking about this earlier this week, health and healthcare will never be the same after this moment in time. So how do we think about, once we're through, respond and recover, the reset and reimagine? So excited to talk a little bit more with this group about that today.
That's great. Thanks, Jennifer. Appreciate it. Paris, how about yourself?
Yeah, wonderful. Well, thank you for having me on this and for putting this topic out there. Obviously, I think everyone is spending a lot of time thinking about this who's in health tech. I run a company called Ovia Health. We're the largest digital health platform for women and families. Over the past 8 years, we've helped about 14 million people do family planning, fertility, pregnancy, postpartum, and we're very much on the front line. So, daily we're touching about 40% of the pregnancies in the U.S. And have very much seen the way that our users are responding and the healthcare system is responding to COVID in real time, as we're getting tens of thousands of questions a day of people making life and death decisions about how they're going to move forward with their maternity care. And I think that especially for the childbearing populations, COVID is going to radically change the way that they see the healthcare system. And I think it's radically going to change the system from a focus really on the folks that we all think about and talk about, providers, systems, and payers, to really that, we call them users, the healthcare system calls them patients, members. And I think that what that looks like is the healthcare system is going to be forced to serve people in the way that they want to be served by every other industry. And that when people say, I don't want to see my doctor anymore, I don't want to go to a hospital, I don't want to do that we're all going to have to respond and give them some solutions to do that, because they're going to be the ones who are ultimately in control of the dollars more and more, and the ones that are forcing us to reinvent the future. So I really see that coming, especially on the tail end of COVID, once people have kind of tasted the future a bit and seen the type of innovations that are out there. It's just going to be rapidly accelerating towards a world where there's very, very different types of players in control of the system and its development.
Oh, I appreciate that perspective. Well, why don't we just dive into it with a few questions before we bring in some of the audience questions as well. Anna, let's start with you. Since you're in the front lines of this pandemic, can you describe some ways healthcare delivery technology is helping or enhancing outcomes of your patients? And if it's not helping, what would you like to have?
Sure. So I think we've talked already a lot about the fact that a lot of healthcare, I think, has gone, well, certainly in the ambulatory setting, things have pretty much shut down, and almost all visits are being done by televisits and video visits, which people have been talking about for a long time. And this pandemic made it imminent that it had to be rolled out. And I think that that's been very much a good thing. The other technology that we've been talking about that this pandemic has required us to roll out and has been successful, certainly at my hospital and other academic medical centers, is using technology on the inpatient setting, right? I don't think we'd ever envisioned that we would need to use video cameras to talk with our own patients, or iPads or Surface tablets to talk with patients that actually exist within our own hospital. But it's necessitated by the fact that in order to go in to see a patient, you're going to expose a healthcare worker, many healthcare workers, use that PPE that we don't have. So we've actually very rapidly rolled out Surface tablets and iPads so that we can remotely interact with patients and then also monitor them from anywhere really in the world.
A follow-up question on that, because we deal with this a lot in our business. How are you thinking with things moving so quickly? How do you think about using more consumer-facing technology in a HIPAA-controlled environment in these times when things are moving so quickly? Is that a big worry for you, especially in the inpatient setting?
No, I think it's, I think for a long time, the way that we've delivered healthcare has had to change. I think that's probably what this group is all about, talking about how it used to be that doctors and healthcare administrators figured out how we wanted to deliver healthcare, and the consumers had to take what was given to them. And that one size fits all approach, it wasn't going to work, especially with the times changing, with younger generations, people who are growing up doing everything on tech, and newer generations of doctors and nurses and administrators. I think we also want to see things change. We've talked a lot, the healthcare leadership team of the hospital has spoken a lot over the last month about how the way that I trained during residency and fellowship, and the way that we were training residents and fellows up until this last month, was the very same way that the people who trained me and the people who trained them, all the way back to kind of the beginning of the 1900s, that's how we were all trained. And everything has changed in the past month. So I think that people on the front lines would be very amenable to the kind of products that you're talking about.
Oh, that's really great. It's very interesting because we've been living in a world where getting into a hospital with new technology has always been, well, hellish and difficult and problematic and so on and so forth. And to see this embracing of gadgets for whatever reason will hopefully open those doors that you're talking about. Thank you. Jennifer, how about yourself? Like outside the hospital atmosphere, what are some of the impacts of the overall health ecosystem during COVID that you're seeing?
I'm going to sort of pick up a little bit on where Anna was just talking about, because I think that was so interesting. This notion of, for so long, I think both consumers and clinicians were a little bit resistant to doing things virtually. They wanted to go in, touch, feel, talk, be in the office, in the space, having that interpersonal. And in some recent research that we've done on consumer behavior, in fact, a study that literally just hot off the press, we observed that there was an 11-point increase in movement towards virtual health in just the last 6 weeks. So incredible movement in terms of the comfort level and the interest. And of course, some of that, of course, is driven by necessity right now. And so it'd be really interesting to see what of those threads pull through. Because of course, the other things that we're seeing from the consumer perspective are 82% said they have felt anxiety or fear due to COVID-19. And this is across geographies, whether they're in a hotspot or even in a geography where they haven't had a surge and may never have a surge. And so I think that combination of where consumers are today in terms of hopelessness versus hopefulness, fear and anxiety versus confident trust of the governing authorities, trust of the healthcare organizations and systems is going to have such an important play as we move into recover. And we've also seen there's actually a higher willingness to sharing data and information. So, in the US, unlike in some other countries around the world, I would say we've always been very reticent and very mindful and careful about what we share. And it's interesting to see how some of those sentiments are changing because, of course, pulling that data together and the interoperability there becomes so important to enabling a lot of these technologies. And so I think other things that we're seeing are, interest in remote from home. You talked a little bit about wearables and remote devices. Like how can consumers be monitored, both their health and if, God forbid, they get sick within their homes? And at what point can they do that, where they cross over and they actually do need to come into the facility? So we've just seen drastic, remarkable changes in that space. And then use of some of the technologies, whether it's conversational AI, the willingness to engage with a chatbot if you're going to get the information that you need in a timely fashion has also been really, really interesting to see. So I think the consumer shift in behavior has been quite remarkable. And I think as we move into recover, as healthcare systems are interested in opening up again, in a way so that they can bring in additional procedures, elective surgeries, all of that pent-up demand. And obviously it's going to be important and incumbent on both sides, both parties, clinicians and consumers, to continue to move that trust forward. So I think that's been something we've really observed. The dramatic change has been really, really interesting.
Really interesting, Jennifer. A lot of what you're saying, to speak about your first point, I think a lot of the resistance from the medical community, from physicians about doing things virtually is that you can't deliver all of care, through a computer, through an iPhone, through an iPad. There is a lot that we need to do by touch. That being said, certainly in higher socioeconomic classes, everybody has, an Apple Watch. People have, sensors where they can do EKGs from home. It would be great, and I think people are probably working on, widespread kind of continuous temperature monitoring. But in order for it to be successful on the whole, this has to be something that can be delivered to the population. From your knowledge, in the industry, what are the thoughts you think from government payers? In order for us to continue to do a lot of virtual care, I think we'd have to have certain things like just basic vital signs being able to be measured at home.
Yeah, no, interesting. Great question. Thank you for that, and great comment, and absolutely 100%. And of course, certain hands on the patient or hands on, will never change. But we certainly have seen an incredible relaxing, I would say, with the regulatory bodies in terms of supporting virtual, right? So I think reimbursement for virtual has increased tremendously across almost every state. Recently, particularly with the pandemic, of course, that's been the case, and even some of the HIPAA requirements have been relaxed a little bit. So I think the regulatory bodies, CMS, FDA, CDC, are really looking at this in a very different way and realizing their role in helping to encourage and support the right behaviors, both consumers and clinicians. So I think that's one thing that's really, really important. And then some of the technologies are remarkable. So there's an Israeli tech where they're actually developing, and I think it's even in market, this ability to use facial recognition to actually take vitals. It's an organization, Bima.ai. And so the technology, that in-home technology, that little computer that many, many people do have in their hands, has just been incredible in terms of the data it can collect, the remote access, and the real-time data. So particularly in a pandemic like COVID, we're monitoring, real-time monitoring and consistent monitoring versus with these events over the day or over time becomes so important because, and as you know, your oxygen levels can change, at a turn of a dime. And so to be able to monitor that on a regular basis through a hospital at home setup becomes, I think, incredibly important as we're managing.
That's really interesting stuff. So, Paris, what do you think? We always look for these actionable insights, as a way of driving healthy outcomes. What types of insights have you been able to drive in and around COVID-19? And are you making changes to the way your platform operates because of the pandemic?
Yes, it's a great question. We're in a pretty unique position as being one of, quote unquote, those solutions. So touching 40% of the pregnancies in the US daily, having those people share hundreds of data points and essentially being able to be a real-time digital screening tool for them puts us in a unique position. So very early on, as soon as ACOG put out its screener recommendations around COVID for pregnancy, we launched a first of its kind screener. We're actually able to screen 200,000 women in the first 3 days that was out. And what we saw, it's not as scary as it sounds, what we saw is that 30% of the women taking those screeners had COVID symptoms. And it turns out that was the case because many of the symptoms that you have when you're 9 months pregnant are also the symptoms that you have when you have COVID, right? If you are 9 months pregnant and can hold your breath for 10 seconds, you are in the top 1%. So what that allowed us immediately to do was create specific guidance above and beyond kind of what was out there, be able to say, look, this is what the data is telling us. This is what we're seeing within the population. This is how we should be thinking about it. And then quickly connect with our research partners to get that information out into the public domain. And again, I think that's another piece, right? The consumer organizations that's in their DNA, that's not in healthcare DNA, is moving quickly. Right? And yes, you need to make sure that you are using evidence-based methods. You need to make sure that you're doing the right thing for people, but you can't wait on a lot of these things. And the 6-month recruitment into a study you know, getting the IRB, going through, you know, waiting for editors to publish it, right? That system doesn't work. And so again, it's really about how do you modernize the healthcare system, and so it works at the speed of all of these other industries. I mean, could you imagine if, you know, Google only made updates to its search algorithm every year, or if there was only one app update for, you know, your favorite app once a year? It just doesn't work, and that's the way the model's set up. And so, you know, I think what we're able to do, being very evidence-based and thoughtful about it, but also having access to the data in real time, is quickly shift our approach to serve our users, and to really give them the tools and resources they need in real time to be able to make better healthcare decisions.
Paris, first of all, thank you, because managing healthy pregnancies is you know, utmost important, given some of the maternal mortality rates that we've experienced for a developing country. And thank you for your comment about holding your breath as a mother of three. I appreciate you're recognizing how challenging that is at certain stages. So you're obviously clearly an expert on consumerism and consumer behavior. I'd love to hear a little bit more about how you grab the consumer, what kind of techniques you found as you bring them onto the Avia Health platform, and how do you sustain that?
Yeah, great question. So, you know, I think to some extent, not to be too negative about it, but right, the success of platforms like ours show, to some extent, the ways that the healthcare system are failing patients. You know, the statistic that we found is the average OB visit is 6 minutes, and you have on average 12 visits with your OB for 6 minutes apiece. And so our average user spends more time inside of our digital application per week than they do with their OB for the entirety of their pregnancy. And there's a lot of questions that people have, especially in something like pregnancy, where it's impacting everything in your life, that it's not just enough to get your clinical questions answered. They need to be given perspective, and they need to be personalized to you. And what we found, kind of the magic of what we do, is we ask users to share their most important health and life information. And based on that information, we're immediately able to personalize the experience to them and give them actionable information and show them how sharing that information actually improved their experience and how they're getting value out of it, which creates this amazing virtuous cycle. So believe it or not, our average user is coming back more than daily. And they're sharing about 200 data points about themselves per month. And so, you know, we've talked a lot about devices and what are devices doing and how can we use those to passively track people. About 5% of our data comes from devices. We have 20 billion self-reported data points across 13 million women. We just ask, and we tell them why we're asking, and we give them value for the data that they're sharing with us, and we treat it in a very, very, very private way. We never share it with anyone else. And doing this, they really feel safe. They're getting value from it. And we create this really meaningful digital relationship with our users that gets more valuable the more time they put in, they share, and the more information they share with us. And again, I mean, I just imagine, you know, my annual PCP visit where I'm filling out the exact same paperwork about the exact same allergies and the exact same medication that I filled out for the previous 10 years. Or when you go from one, you know, floor of the hospital to the next one and have to fill out all of your information again. No other industry works this way, right? It's, you know, imagine if every page on the Google search, you had to re-enter your search term and say page one, right? It just wouldn't work. Healthcare has gotten away with it, I think, frankly, because typically the consumer in the past has not been the primary payer. But as the primary payer becomes the patient, they are going to demand that healthcare works like everything else works. And again, it's just that magic experience that you hear tech companies talking about. When she says, hey, you know, I just had my ultrasound and I'm having a boy, and all of the pronouns throughout everything else that we tell her for the rest of her pregnancy turns into him, boom, it's this magical moment that really changes our relationship with her.
Oh, that's fascinating. Thank you. I really appreciate hearing that. Anna, back to you. You know, we've said it before, and I complain about it myself. Health tech implementations are long, expensive, terrible experiences for everybody. So what's changing during this viral outbreak? Like, what's the impact been from new and existing projects coming on board or being delayed? Like, what are you seeing?
Yeah, it's an important point that Paris made about the way that academic medicine has happened for years on end. And certainly for the way that we're managing COVID and treating patients, we can't wait for clinical trials to recruit patients and study them and, you know, reflect on the data and all the applications to FDA, et cetera. So things are changing very rapidly. The delivery of information now in the healthcare setting has completely changed overnight. You know, COVID, as most people know, is a respiratory illness, but it actually has a lot of neurologic complications. And that's not something that, you know, as a neurointensivist, I can find out 6-12 months from now because I have COVID patients today. And so, you know, for instance, in our group, you know, we thought about this very early on, like how are we going to get information and how are we going to deliver this kind of information, you know, and disseminate it out into, you know, the public about what to do for these patients, especially for people at community hospitals. There might be places where they don't have neurologists, let alone neurointensivists. So for instance, our group, you know, instead of going the way of trying to work through societies and get guidelines and publish them in academic, you know, medical journals, we bought a website and we distributed all the information that we could find from studies in China and studies in Italy on what to do for patients, and disseminated it. It's being updated weekly. And now tens of thousands of people from around the world are looking at this data and helping us contribute to it as well by giving input. So that's one way that the delivery of medicine is completely changed.
And just it's fascinating, right? Because we see ourselves as a platform doing similar work, right? We're doing some of the primary research and then trying to disseminate it and get it out there. The question, my question is, right? How do you prevent fake news? Right? I mean, so much information out there. It's just getting harder and harder to parse. And that's something that we've struggled with, right? How do you really keep the evidence-based scientific method while moving faster? And, you know, do you drop the confidence interval that you're willing to use, right? I mean, I don't know. I mean, it's just a really interesting question. I'm sure in academic medicine you're thinking about that quite a bit.
Yeah, so absolutely. So we recognize the need, but you still need to do both, right? So the first thing we did is open up a website and we put out all the information that we could find. And the second thing that we're doing, which is the reverse, is now we're writing up the manuscripts. And now we're putting it, you know, to publish in, you know, in legitimate medical journals. Because I think, you know, for the most part at academic medical centers, when there's a dearth of information, people will listen to things like a website. But as more information becomes solid, then they are looking to, you know, the JAMA, the New England Journal of Medicine, and et cetera. So the part that's most interesting to me as an academic is that the process of this is changing. It used to be the information was on New England Journal and then it made it to a website. Now it's the opposite.
Mm-hmm. Are you guys seeing that UV light and disinfectant is really working?
Right? I mean, there's so many things, right? All the time, our protocols, if we weren't updating them several times a week, then what happened last month might have been 10 years ago.
No, that's good. Sorry, I thought you were going to ask if she was drinking some Lysol. Interesting. Jennifer, now let's talk about consumer behavior. You know, we hear about, I am a consumer right now, staying at home for 6 weeks, and you know, the way you look at things has changed, and what you view about your health and even how you behave when you go to the store has changed. What are you seeing from a healthcare health perspective on consumer behavior?
What I was saying is we've talked a little bit about, we've seen this incredible uptick in adoption, if you will, of virtual platforms, and an 83% statement around willingness to trust AI and chatbots to engage. We're seeing, at least Paris made a great point about willingness to share data, particularly if we know it's going for a good purpose and going to a good place. I think the thing that we're going to really need to look for and figure out together, frankly, is what we need to do to now re-engage consumers and their trust and regain their trust as we think about the reopening of healthcare systems. And so if you think about it, the healthcare system has been, in respond mode for 2 months now, dealing with things like, do I have enough PPE for my frontline clinicians? How can I segment my facilities such that I can create spaces where we can accept COVID patients and decant into other spaces for non-COVID patients? What elective surgeries and other procedures have I put on hold, and how long can I continue to put those on hold? Because of course, for certain cancer procedures, certain cardiac procedures, you can only put them on hold for so long, right? And so there's so much right now that a healthcare system, I think, is leaning into, in addition to the fact that many of them have taken tremendous financial hits in the last couple of months. I mean, they're reporting 20 and 30% hits to revenue. And even with all of the federal funding that's coming in, I think this has taken a significant toll. And so as we think about reopening and ramping back up, all of the complexities, very much driven by consumer behavior and consumer trust, workforce and workforce trust. How do we bring workforces back online, and which ones do we bring back online in a way that's safe? Because safety, I think, right now is top of mind for everyone. And what workforces, frankly, have been very successful working remote. I think something like 62% of the employed population in the US is working remotely right now. And what should remain remote? So 32%, I think we surveyed recently, reported enjoying working at home, and their bosses, their directors, have said actually working at home is working really well. People have been very productive. So I think for certain workforce segments, that's going to continue to make a lot of sense. Productivity, work-life balance, and all of that, of course, also requires great tech, and requires people like me to know when to go on and off the mute button. But I think that will be a dramatic change as well. So as I think about everything the healthcare system has to put together, clinical, procedural, safety, societal, workforce, technology, really a road ahead as we get to recover. But I think securing this consumer trust, and Paris, you articulated it so well in terms of what are we asking for and what are we giving back, that reciprocity is going to be foremost.
As a doctor, right, and a healthcare administrator, I'm very curious, really from everyone's perspective, but in particular yours, Jennifer, as we talk about, reopening in terms of healthcare and how we're going to first transition in the people with, quote, semi-elective surgeries that really probably don't feel semi-elective to them.
Right.
What do consumers want? How do they want to see healthcare reopen? I think we're experiencing kind of an all-time high, at least in my career, for the fact that I think the average person trusts me, is proud of me, calls me a hero. How can we use that and leverage that into kind of an improved relationship between, patients and physicians and healthcare, as a whole going forward? What do you think people want to see?
Yeah, no, great question, Anna. And yes, I would say from the data that we have, people absolutely are seeing frontline workers as great heroes, equal to firefighters. Like sort of, if you think about the heroism of 9/11 and sort of the status of the firefighter, if you will, after that tragic event. So absolutely frontline workers are heroes. I think a couple of things, and I think everyone on the webinar today could probably add to this. Certainly transparency and safety are paramount, there's no question. And I also think on continuing some of the remote and virtual access that has been provided, that has been forced, and that has had to be put in place so far. So if you think about the typical, you arrive, you look for parking, that takes a little bit of time. You get in, you're waiting in the waiting room, you're signing in, you're getting in to fill in the paper and the charts, and maybe it's digital, maybe you've had an iPad, and then some vitals are taken, and then you're waiting. And then finally the procedure happens, and then you're in the room after recovery. So I would say is what of that flow, what of that experience, what of that consumer experience could be digitized, could be virtualized? And if we really challenge the orthodoxies that I think the pandemic has started to shatter, and think about what absolutely must happen in a room in person, and what is everything that we can digitize and virtualize and exceed expectations on, and frankly, both for the clinician and for the consumer, because I think, you know, that relationship will always be there. But as we think about what can we act on from all of the natural experiments that we've seen so far within the realm of trust and safety, I think those are the themes that we're hearing a lot about.
That's great. Thank you. Here's one. Healthcare is fast evolving. What do you anticipate happening in the payment model? Jennifer, why don't we start with you on that?
Well, it's very interesting to see what's happening there right now. I think payment models are clearly evolving. Right? I think health plans, as they're looking at changes in what's happening with claims, if you look at the claims data, it's fascinating because, so as you can imagine, if you are at home, you're driving less, so there are less accidents, you're out and about less, so there's less contact, COVID, but also any other transmittable diseases. And of course, as we've talked about, elective surgeries are being held back in a number of procedures. So I think as they look at the claims data, what health plans are seeing is a vast change in MLR. And how and when and where will that start to come back and to change, to go back to, I won't even say normal, but any kind of sort of where it was pre-pandemic. I think the plans that we're working with are certainly thinking about things like how can we interact more and engage more with the consumer to understand who they are and how we can be supportive and helpful in this. Virtualization and digitization is absolutely something that they've been moving forward on already, I think increasingly so now. So I think we're going to see a significant shift in payment models as a result of this. And as we see sort of the potential bumpiness of what it could be a potential wave 2 in the October-November timeframe, and then, you know, again, hopefully flattening. But COVID will be with us for the long term, right? And so, and if it's not, then it could be another super bug, unfortunately. And so I think this notion of transformation and moving into what is a new reset, a new way of being in the health economy is in front of us. And I think everyone is really trying to figure out how to adapt to that.
Yeah, and as the crazy consumer guy on the panel, I'll say, you know, the wacky things, because that's always the most interesting on panels, right? I mean, the best thing I heard was that all of the trends that were already happening before this are just going to go exponential. And unfortunately, the crisis has taught everyone what exponential means versus linear, right? And I think what you're going to see, especially if digital health wins, is what technology has done to every industry, right? Which is, you know, as opposed to having a newspaper in every town, you have a website in Palo Alto and no newspapers in any towns, right? A taxi business in every town. Instead, you have a company in San Francisco, you know, and independent contractors across the country. You know, and I think it's similar with healthcare, right? How much of healthcare costs is the cost of just providing the care versus the infrastructure and overhead of running a hospital and doing the real estate and buying the equipment and doing all these other things. If you can actually turn that into something that can be delivered with technology, you know, and be done scalably, there's going to be many fewer players that are making much more money, and all of kind of the regional infrastructure or localized infrastructure will go away, you know, and prices will come down, and people more and more often will compete on prices to consumers versus, you know, however pricing happens currently in the healthcare system, which I have not been able to figure out yet. And I think you see that again and again and again to every industry that's been disrupted by technology. healthcare has been the most resistant because they have the most entrenched, highest margin players that are just so concentrated. But maybe COVID will break that down, and all of a sudden, if you get to make the decision, do I want to go to the hospital and pay $1,000 for this thing, or do I want to stay in my home and pay $100 for this thing, or $10 for this thing, or watch an ad and then get it for free? I think a lot of people might change it, which means all of a sudden you don't need a hospital in every town, right? And so on and so forth. So when this wave happens, it's going to happen exponentially, and this may be, right, that wave that's about to crest, and then everything changes almost instantaneously. How's that for the bold consumer guy statement?
I love the way you're going to make it like NASCAR with ads all over you to get your care. And I have a question, because we're looking at this crisis today, and we can look at the reactions that we have, but this isn't the first pandemic we're going to hit. We get flu season every year. We get something a little bit more, let's say, deadly every few years. So what can we do for future pandemics, and what can HealthTech do to help prepare everybody to, not just a fall resurgence, but what's going to happen in COVID-22 or whatever we're going to call it next?
It's a good question. Maybe what I want is achievable, maybe what I want isn't achievable, but I think if we had widespread monitoring of population's temperature, we would probably learn a lot. We use these artificial cutoffs right now as to what we call a fever and what we don't call a fever. And I think it might have been in the popular science news maybe a few months ago before the pandemic ever hit. But what we think of as a normal temperature was decided a very long time ago when people actually had a lot of chronic illnesses that were present. And what a normal temperature is probably lower than the 98.6. And in medicine, when we have an absence of kind of what a normal range is, we use an individual as their own control. If we had the ability to monitor an entire population of their temperature continuously, we would probably have fairly good information early on when that changes. I mean, I know that Paris could probably talk about the fact that the temperature changes are being used to determine when patients, when women ovulate, for instance. We all kind of have a normal range. And if we knew that for an entire population, and then we saw a certain degree of shift or certain percentage shift, we might know when an entire population is in that pre-symptomatic stage. And part of the problem with COVID and why it's just been so difficult to control is for the amount of time that people are shedding virus and they're asymptomatic. They might not truly be asymptomatic. Their temperature might actually be elevated, just not, quote, a fever. And so if we had that, I think it would greatly change things.
Hey, just a follow-up question to that I've been really interested in is, how much of it is our modern lifestyle? I mean, obviously, what's happening with overcrowding and overpopulations in certain parts of the world, but then also just, right, Americans' health. I've been flabbergasted by what percentage of the people I know are high risk, not because of their age, but because of their underlying medical conditions. That seems like it's really making the population even more vulnerable to this type of thing as we continue to push the boundaries of, our interactions with the environment as people get more and more desperate.
Yeah, it's an important point that you bring up, the fact that the population as a whole, I guess it depends on how you look at it. The population as a whole is unhealthier, but as a whole, we're also living longer. So I'm not exactly sure, how exactly to parse that out. Another piece is that, the global urbanization has actually really led a lot to why we're seeing this pandemic now and why there's been an increasing number of emerging diseases. Again, the neuroinfectious disease hat that I have on, we've been talking for the last decade about how there's been an increasing number of emerging infectious diseases. So the fact that this is coming now has been predicted by other people. I mean, there's not a surprise why we've seen SARS and MERS and Ebola and now this. There's just more of the population interacting now with areas that were previously considered rural or uninhabited.
Well, that's great. Well, thank you. So this is really good. Now we have one question here, and it'll be our last question. I'm going to start with Jennifer. This question is about, I'm going to just rephrase it, workforce repatriation.
Yeah.
I think we're, whatever business you're in, coming back to lockdown, to going back into the office, or going back to school, or whatever it is going to be a change. And what types of what type of repatriation strategies are out there? Because right now everybody seems to be left on their own. Are there standards that should emerge that actually can help people understand, make sure they don't have any flare-ups in their own business, and so on and so forth? What are you seeing?
Yes, well, I certainly think there's a lot of thought being given, because I think if we think of the hierarchy of needs as we think about return to work, right? One of the first ones is, how are we getting our arms around testing, contact tracing, and self-statusing, right? And you mentioned the Apple-Google collaboration earlier, and that's progressing magnificently in terms of ping and identify based on the technologies that they have in place. Other countries around the world are actually also putting these strategies into place and these technologies into place. Certainly Germany and the UK has started to do that. There's a cultural piece in the US that we need to decide if we're going to get comfortable with, right? Because in some cases, it feels very invasive to be asked or mandated to reveal my health status, right? That's always been what HIPAA has been in place to protect me from that, because of all the potential repercussions. And one of the things I think as a country we're going to have to grapple with, and as a society, is how willing are we and how quickly are we willing to actually go there and be willing to share that, because the technologies are certainly available if we are willing to share that, to identify, to trace, to track, and therefore to, I think, enable us to get back to work more quickly. So that's sort of step one, and that's a big societal issue, not simple to solve for. But then there's also this notion of who, when, and how, right? So which workforces actually should return, and in what format? Does everyone return full-time? Do people return in part-time capacities, and part remote, part in person? And so we put some frames together. You can do some analysis on this from two perspectives. One, the macro around what are the kinds of workforces that in fact are doing either synchronous or asynchronous work, meaning can the work be done remotely, or does the work actually need to be done together? And so that analysis can happen as a way of thinking about it. And then there are tools. There's an organizational network analysis tool that actually just leverages email and very simply crawls email and creates these sort of brilliant network heat maps to show you where productivity is happening and where it's not. And so you can actually do that analysis pretty quickly to understand, of your remote workforce today, how and where people are being productive. And people actually may be more productive today than they had been. And that can also help as an analytic tool to then figure out the prioritization of how and when you bring different workforces back in.
Well, that's great. And I think it's an important topic, because everybody is very afraid of how to do and how to do it right. And I appreciate the strategies you're implementing, but it looks like we're out of time. And I just want to thank each of you for joining us. First, the panelists, for taking your time out of great things you're doing in helping, but also to all of our attendees.